you get a shock when that buzzer went off? Did it shock you in the hand?
Yeah, I did.
Okay. That's innovation in real time, right? I mean, we had a sort of a system that was keeping us posted this way, and this keeps us all honest, right? So first of all, thank you for being here, the opportunity to talk to you today about what we've done at United. My name is Chris Carlson. I've been there for 14 years. A little bit of my background, I'm not nearly as impressive as the vast majority in the room, but I have a degree in genetic engineering. I have a master's degree in finance, and I was a chemical engineer for 10 years, which doesn't qualify me for anything related to literacy, but it does qualify me to talk about how to solve problems. And at United, that's really been what we're tackling now for the last 6 or 7 years relative to consumer engagement, consumer experience, and more focused here in this conversation, literacy. So the topics we'll cover a little bit earlier. I think Dr. Rosoff mentioned the importance of trust, and I cannot underscore enough every theme in our work at United when it comes to consumer experience and provider experience is actually underpinned by the notion that trust has to be everywhere. So we'll talk a little bit about that, the case for change at United, as well as our approach to implementing several tactics related to that change. A few case study examples. There's clearly evidence in the literature, even in the conversation today, around the clinical benefits and the societal benefits. We'll talk a little bit about some operational benefits related to administering a plan. And then lastly, we'll return to the case for the consumer. So I think every one of us, I know I personally have had experiences where literacy was a problem in the health system. Personal experience with my in-law, my mother-in-law, my mother, where the system wasn't talking to each other. Physicians across the street from one another didn't share information, and what they shared to us didn't make any sense. And there were a lot of bad outcomes as a result. So I think we all have a personal stake in simply the case for the consumer. And I'm not much of a formal presenter. I'm more of a conversationalist. So if I rush too fast or go through slides that have already been covered, I won't worry about it too much, but I'll look forward to questions during the follow-up. So ultimately, it is all about trust. And my focus in our organization is on the consumer and the customer experience. And we start nearly every strategic conversation in my world with the concept of trust. Trust is a function of credibility. Do you believe the source? Is it credible? Consistency. If someone calls you today and asks for instructions on post-acute care, and then you call the next day and you get the same instructions, that's good. If you don't, that's a problem. And ultimately, intimacy, and this is really the form of being very personal. Do they really know you? And when you have the conversation, when you interact, do you feel like they are actually personally engaging with you, or are they saying something that they've been told to say or that is generic in terms? Legalese tends to have a lot of sort of impersonal tone to it, and that's a problem when it comes to trust. Ultimately, this all has to be underpinned by a sense of orientation back to the consumer. So you can be credible, you can be consistent, and you can be personable, but if you still speak and act and engage with the focus of the entity in mind and not the consumer, you're going to lose. End of discussion. The jig will be up. It is that simple. And so all these experiences that you have interacting with your health system as an individual or the health system between actors in the health system has these components, these experiences must sort of equate to trust. Trust begets engagement. And I forget the gentleman who said it earlier, but this all leads to engagement. Literacy equals engagement when it's done right. Because the unique thing about healthcare, and it's in every part of the system that we all interact in, whether it's research or delivery of clinical or actually administering the plan, healthcare is very emotional and it's very situational. If I buy a washing machine online from Amazon, they are credible. They've created some consistency. They've done a great job creating personalization, and they've created a way that makes it feel like it's all about me. I don't have any issues buying a healthcare. But the first event, in my experience, that was work-related, that pointed towards literacy, with unknowing that it was pointing towards literacy, was when I was running a training organization. So I had roughly 600 people reported to me, and their job was to equip our customer service team to respond to members calling in with questions. And I decided the best thing I could do was to get close to the member. So I went to Green Bay, Wisconsin, and I wanted to sit and listen, and the first call that came in was a young man who stated quite simply and dryly, I just got back from the hospital. I've been there for 5 months. My wife just died. I don't know what to do. Now, his capacity to understand whatever was said next was zero. The system is not wired to listen to that and actually know what to do. So when it comes to engagement and experiences, the first act is really, as I've said to teams and people in training, shut up and listen. It takes 7 seconds to make a first impression. And if you don't listen to that man, he's never going to trust you. And so our job, what we do, is we build experiences that enable the humanity of what we want to do and what we believe we can do by getting technology out of the way and creating technology as an enabler. And so the system's getting more complex. There are a myriad of ways to interact with different parts of the system: virtual care delivery, virtual service processes, chatbots now who may be replying to your question about something online. You may not know it. Many consumer products use chatbots. Those experiences in the healthcare space have a different price to them. They mean something different. And if that man calls up and he has a dry tone, a matter-of-fact tone, but he says those words, we don't want a chatbot responding to him. We want somebody to listen to him, understand how unique his situation is, and then do whatever it takes to make him better. So in healthcare, in our world, we get all kinds of those experiences, and we have to equip ourselves to be able to handle it. Because what's really important is the health and well-being of the individual, their financial well-being, and that they're getting the right care and becoming healthier. This complexity is not getting any better. It's only getting worse. Technology does not help when it comes to complexity in healthcare. It can be a tremendous burden, or it can be a tremendous enabling activity. But as we heard earlier, the great conversation around the two different EMR systems, if they don't, it's even the same platform, they don't talk, you still need a human being to make that connection. You need someone to lead the conversation to say, hey, A, B, you guys need to talk. What team are you playing on? So the teaming aspect, the care team that Dr. Rosov talked about is so important. Because my initial reflection on that statement is the nurse, the doc, maybe there's somebody at the front desk, but the reality is the care team is any previous provider they might have seen, a neighbor who may be checking in with them on a regular basis, and maybe a cousin in Arkansas calling to find out how they're doing. That's the care team. And so the ability to create transparency and consistency is hindered by our ability to speak simply, relevantly, clearly, and at a time and in a manner in which people will have the capacity to listen. There's plenty of value. I think there's been a tremendous number of great examples today, but from United's perspective, we insure about 14% of the US population. I forget the number, it changes about every quarter, but it's a big number. Which if we use the current estimates, about $240 billion is wasted or is affected by health literacy in this country. That means that for $34 billion for United, there's value there to point to something else. Preventing somebody from going to the hospital gives us an extra day to talk to them about the medication they're supposed to take, or to spend a little more time with their physician in a primary care setting rather than spending time with a physician in the hospital. $34 billion, that's just within UnitedHealthcare's world on the value lost to a lack of health literacy. So a little bit of grounding on the case for intervention. In some cases, when we talked earlier, there was a good point somebody made about education. In United, we've done a couple different things. I don't have any slides on this, but I thought it worthy of note. We train our pharmacy advisors in the Medicare population on how to help seniors with their medications by putting them in very real situations. We bring seniors in, for one thing, on a regular basis, but we also give them big, thick cotton gloves and then say, go open up that pill bottle. Right? Or we take glasses and we scratch the glasses so you can't really see through them, and we say, go read the label on the pill bottle. Because that's the reality of the individual you're talking to on the phone. And so I thought Dr. Rosov's comment on what Berwick said years ago is so appropriate. It's true in almost every industry, but especially true in healthcare. Sit down with the patient. Sit next to them and have a conversation. Matter of fact, our first big transformation at United in years was something we did called Advocate for Me, which was we transformed how we delivered service across roughly 30 million members in less than 18 months. Our team spearheaded that, and the first thing we taught everybody to do when they answered the phone was to listen. We built technology and analytic tools to drive context to the opening of the conversation so the consumer could get on the phone, and our first question was going to be, my name is Chris, am I speaking with so-and-so, and how can I help you? And then you just listen for a long time. Actively, positively engage and listen. If you do that, you may keep people out of the ER, you may keep people out of the hospital, but improving that adherence to treatment plan by clear directions, simple, clear language, in conversation, as well as in digital tools, whether it's a mobile app or a portal or in the service environment. Creating the right language tools on the top desktop of our advocates so that when they talk to a member, they're using regular words, not the benefit structure language that exists in so many documents in the health plan industry. This diagram, I think it's appropriate to articulate all of the factors that go into that moment in our world when we get a phone call, or when we get somebody who logs onto the portal, or maybe dials into the mobile app, or maybe walks into our storefront in the villages. There are a lot of things going on in that person's world, and it is all contingent on whether or not they're going through some sort of health event. Let's reflect back on the gentleman who called us about his wife. In that moment, every one of these factors was in a tough spot for him. You can forget about the health literacy components, his self-efficacy, his ability to take care of himself. There's a fair amount of literature out there that points to comorbidity of depression and other behavioral issues when people have a chronic condition. Well, folks, literacy doesn't get better when you have behavioral health issues related to depression or other indications. So you have to understand the importance of that factor. Everything else gets more complicated in that emotional distress state. The ability to participate in making decisions. If you haven't read Dr. Topol's work, The Patient May See You Now, I highly recommend it. It is absolutely, in my mind, the future of where this country will go when it comes to medicine. The consumer will become the decision maker. The consumer, I know my kids, I have 3 teenagers, they demand to be included in every decision. They don't make phone calls, they simply consume information digitally, but they don't obviate their responsibility to make decisions. The consumer will be empowered. The consumer will demand the democratization of their own data, and the consumer will no longer go to the physician's office and say, what should I do? The consumer will go to the physician's office and say, here are some things I was looking at. It's just like when I buy my car. I was looking online, I like this, I don't like this, tell me what's gonna happen. And in the extreme case, they may be as informed as a physician at that moment around pain, life expectancy, chronic conditions. That future state, I believe, is going to be accelerated by our ability to incorporate literacy and engagement tools into every interaction we have. Ultimately, members' motivation. If a member isn't motivated to take care of themselves, literacy is not relevant. Now, motivation is degrees. If someone has been frustrated by a system that they don't understand, that is going to affect their motivation. That's a literacy issue, not a motivation issue. And the further they have felt like there are barriers, there's resistance, or there's complications, they can't understand what to do, bless you, they will begin to feel like it is no good, and they will become demotivated. Motivation is a function of understanding and personal drive. That capacity to understand is a function of emotion, and a function of literacy, and a function of your current situation. So ultimately, there's really 2 ways in which we look at the function of literacy and engagement United. One is our own interaction points within their journey. So in a prospecting cases, people might be looking at what options they may have relative to health plans. We may be one of those options. There may be degrees of types of plans within us as an option. Certainly educating them on why they might pick one brand versus another, one plan versus another, and then decision support tools to understand people like me. Right? Sometimes the first question is, my wife's going to have a baby in 6 months. Which one should I pick? Which plan is right for me? Should I have an HSA or an HRA? Should I take a different type of approach? And then you have the concept of onboarding. We have so few tools around the onboarding process to really equip people to better use their plan. I'm mindful of the clock now. It was a good idea. We made that change. The process of onboarding, servicing, and then engagement, those pieces of the puzzle for the consumer, we're very much engaged. The other half, though, you have their entire ecosystem at home. Family, friends, the physician, the pharmacist, everybody, their financial situation are all dictating the experience as well through conversations, through digital interactions, and instructions. I'm going to pass on this page because I think everybody covered a fair amount of detail, the case for change. I do want to talk about our approach, though. Let's get to that. So at United, we took approach simplicity, accessibility, encouraging an understandable and relevant context, and then actionable. Consumers really don't want to engage unless there's an action. Sometimes that action is to do nothing, but to stop worrying. That can be an action. Stop worrying, you're fine. Or this is taken care of. That is an action. Our areas of focus when we started to really take this on, readability. We created things like the Just Plain Clear toolbook, the Blue Book, the Writer's Guide for internal writers, our English and Spanish and Portuguese glossary, our Just Plain Clear scorecard. These are tools I'll spend a little more time on in a second, that ultimately created a foundational set of change that, to the earlier discussion that Audrey led, really got people galvanized around embracing literacy as a necessity to drive the organization. Our purposeful actions over the last several years, really we took a top-down approach to communication. We had a chief consumer officer. He essentially said this is the way it's going to be, and we all got in line. Steve and I met probably 6 years ago and spent time thinking about where it had to be changed. We first started with all of our operational letters. We had 3,700 templates, over 100 million touch points. We rewrote every one. And if it wasn't necessary, we got rid of it. We created learning. Everybody had to take it. Over 200,000 people have taken this class at United. It's a lot of learning on health literacy. We took tools, resources, made them accessible to everybody. Just Plain Clear, the glossary is out there. Over 150,000 people, I think, in the last year have accessed the Just Plain Clear glossary. It's just about tripled every year since we published it. Pretty amazing. So we took very deliberate and actionable steps to incorporate change, not just in what we did, but what we sent our consumers and our members. In addition to that, we took all of our service agents and we put them through training on engagement, literacy, positive engagement, active listening, to incorporate in their process that first step of listening. All right, it's a bit more on the business case side. You promise I won't get a shock if this goes off? Okay, good. Just for that, I'm going to keep it on the table. There's 12,300 terms right now in the glossary. It's been accessed, as I said, about 150,000 times last year. I don't know what our tick is at this year, Steve, but just about tripled every year in terms of access around the globe. 68 different countries access this tool on a regular basis. We track the top discussion points searched, the top clinical and non-clinical words searched, and we've gotten a lot of activity across this organization, United, on the use of this tool. Steve really was the driver of this from the get-go. Now, a bit of the case, right? Very tactical case. 2012, we were mandated by DC to send everybody a letter. Every member had to get a letter. We were told who to send it to, what to say. It had to be on our letterhead, and we had to make very clear that it was signed by our CEO or our medical director. That's not a very good way to think about listening and understanding and engaging, and essentially, from a literacy perspective, was not a good point at all. Here's what it created for us. Of the 34,000 or 36,000 members who got the letter, half of them called us and said, what happened? Why did you do this? Of that half that called us, roughly half of those folks had never called us before. And a good third of them called us 3 or more times in the next 4 months. We created an emotional instability in everybody who got that letter. And half rightfully pitched it in the garbage and said, it doesn't apply to me. But the other half said, holy crap, does this mean I have HIV? Does this mean my spouse has it? What do I do? How do I know? Why are you sending this to me? And as evidenced by the repeated phone calls from people who had never called us before, not only were they nervous, they were really going to be damn sure that we weren't making a mistake. That costs money, folks. Every time somebody calls us, it's 15 bucks. It's also time out of their day. And for people who never called us before, and they called us 3 times, that's 50 bucks that was unnecessarily spent. Not to mention the 35,000 letters in the first place, which is a couple bucks every letter. It's one case study. The other case study that's significant is when we surveyed our Medicare Part D and Medicare Advantage group members, and we said, how do you feel about your understanding of the materials, your medication, et cetera? And it's not a surprise. When they understand well, they are, I just thought the picture was a little confusing. In terms of Part D plans, 2 to 3 times more likely to call us if they don't have a clear understanding of their benefits. And so we asked members on a scale of 0 to 10 to rate their understanding. If they were 0 to 4 versus 9 to 10, we compared those two populations. And that 9 to 10 population, really 1/3 of the time they call us compared to the population in the 0 to 4. So when people do not understand their plan, in the pharmacy situation, they are 2 to 3 times more likely to call us. On the at the Medicare Advantage level, it's closer to 4 to 5. When people don't understand their benefit, their coverage, their cost structure related to their plan, they are 4 to 5 times more likely to call us. And again, it's 15 bucks a phone call, not to mention time out of their day, because of a lack of understanding, which is really a lack of literacy in the content and a lack of understanding and engagement in the whole relationship. When does the buzzer go off? How many minutes into the? Oh, they turned it off. I was waiting. I didn't get my shock. This is my last slide anyway. So from a literacy perspective, I really want to underscore the importance of engagement, the importance of trust, gotten through a series of experiences that are really all a result of the simplicity, the relevance, and the action-oriented content that's part of that conversation. And it could be a verbal conversation, it could be a digital conversation, it could be a written conversation. But the more distrust resulting from complexity, content, lack of content clarity, lack of relevance. Think of those people who got that letter from the HIV case study. It's not relevant for them. But we create a relevance in their life. All of that leads to frustration, fear, confusion, struggle to understand, which leads to service, anxiety, which leads to more problems than anybody else needs. So at the end of the day, simple, clear, relevant, and focused conversations, digital or otherwise, is what it's all about. But ultimately, engagement and trust, the experiences we have with our consumers each and every day, engagement and trust based on literacy and simplicity.